When you're exposed to COVID, the next step is to take an at-home test, especially if you're starting to show symptoms. And after your first positive test, health experts say you don't need to keep testing.
The PCR test can remain positive for weeks upon weeks upon weeks because it's a very sensitive test.
Once you've recovered from COVID, a positive test result does not mean you're still infectious.
You're picking up an activated virus, and it's not necessarily, your most accurate tests are when you're most symptomatic.
People who are still coughing, have a fever, or other symptoms should adjust the time they spend in isolation.
If you have symptoms, you do 10 days. Once you're finished with your symptoms after that 10-day window, you're pretty much cleared.
The CDC recommends a 5-day quarantine at minimum for those who are asymptomatic or mildly ill, followed by a continued masking for an additional 5 days.
But it doesn't really apply to people with symptoms. They're still coughing at day 6, day 7, day 8, day 9, because that you still will shed virus.
According to Dr. Nistico, being around people when you have symptoms runs the risk of getting others sick. If you're feeling ill, he says you should stay home and get tested. For Arnot Health, I'm Lexi Cutmore.